Assalamu alaikum and welcome to the program Ramadan for Better Health. We wish you a happy Ramadan and hope that we can all be successful in our fasting for this month. Welcome to the program. Today's health topic, we're going to be discussing the spinal column and some of the common spinal injuries, spinal pains. To open up this subject, we're joined by an expert in the area of the spinal column. He's actually a spinal surgeon and a professor of spinal surgery and orthopedics at Al-Azhar University here in Cairo, Egypt. This is Dr. Mohammed Nigam. Assalamu alaikum to you, doctor. Thank you for coming to the program to talk to us about the spinal column. How would you like to start this? Maybe you can start by talking about the role and the importance of the spinal column.
The spinal column actually is the deepest structure in the body, and this is carry motion from the head, carry the head in the top, and transfer these forces all over the trunk to the lower limb. This spinal column divided into four areas: cervical area, thoracic area, lumbar area, which is carry the most of the problems, and the sacrococcygeal area. The cervical area is 7 vertebrae, the dorsal or thoracic part 12 in number, the lumbar is 5 in number, and the sacrococcygeal maybe 8, maybe 7.
And the total number of the vertebrae?
33, 32.
32, okay. These are a very important part of our skeletal system.
Yes.
Can we talk about, you said that they transfer forces throughout the body. What other roles does the spinal column play?
Yes, the spinal column carries many functions, many rules. The first is the transfer of power and facilitate motion. Because we move our skull in every direction over the cervical spine, and this is connected to the scapulae and shoulders via the dorsal spine and the rib cage, and also we can transfer our trunk right, left, up and down. During prayer we can lean forward, during sitting, during standing, and all this power transferred to the lower limb. Not only this rule played by this vertebral column, but there is an important rule, which is a protection of the spinal column, of the spinal cord.
Cord?
Yes. The spinal cord is running or passing in the central canal of the spinal canal. The spinal canal is a canal formed by adjacent vertebrae in each position. So it forms a spinal canal. This spinal canal filled with the spinal cord. The spinal cord is the neural structure which carry all orders from our brain in the cervical region to control all motor and sensory function of both upper and lower limbs.
So a part of the job of the spinal column is to protect the spinal cord. You said that there were 33 or 32 vertebrae.
Yes.
Are they interconnected with each other? Are they somehow, do they pivot off of each other?
Yes, this vertebrae articulating each one over adjacent one. But this is some minute differences between the articulation in cervical region and dorsal region and lumbar region. In the cervical and lumbar region, there is a free motion in all direction. In cervical is more and more motion, so the articulation is so big. In the dorsal area, this motion is limited by rib cage.
The dorsal starts just below the neck, or
yes, this hump in the below the neck, and to the last rib in the back.
Got it.
It is 12 in number, and the only motion is some rotation.
Okay.
Some rotation. No, very limited leaning forward and extension. But most of the motion from the cervical and lumbar region. The sacral area or sacral vertebrae, which are 5 in number, it is a solid part, not articulated.
It doesn't move.
One piece formed from 5 parts. No. This is the curves of the spine. The cervical C1 to C7, and the dorsal 12 one, and lumbar 5, and sacrococcygeal 1 to 5.
Now, I want to ask you about the C1. The C, does it?
Cervical area.
Cervical,
Yes,
okay.
cervical.
And the T for the
Thoracic,
thoracic, lumbar.
lumbar, and sacral.
Got it, okay.
Yes.
Now, there's a big hump. It looks like, this is
This is a normal curve.
This is a normal spine.
Normal spine.
Uh-huh.
So if the spine is straight, we cannot walk.
We need this curve.
Yes, yes. We need these four curves.
And I see two are going
To dorsal and to front.
Got it. Okay. Let's talk a little bit about some common things that we may all experience or wonder about, especially during performing the prayers. I see a lot of people in the masjids sitting in these chairs at the back, and I often wonder why. I feel sympathy for them that they can't perform the prayers. I imagine that they have various problems either with their legs or their back. Can you talk about some of these?
Yes, most of these people is suffering from problems in the legs. Most of the spinal problem don't interfere with praying or sujood or leaning forward during the ruku'. But most of leg problems interfere with this position, especially in sitting between sujoods. So the spine of these people may be affected, but the spine not play a important role in this position, because spine is get a value or get health with this motion.
I want to ask you about neck pain. This is the cervical area?
Cervical area.
Cervical
yes.
area, okay.
Cervical area.
What are some of the common causes for neck pain?
Oh, this is a very good question, because the spinal pain or neck pain in this area may be started from the vertebra, cervical vertebra, or the bone of the cervical vertebra, or from other structures like surrounding muscles, surrounding ligaments, or even in the organs, some glands like thyroid, like any other glands in the cervical area, or from something like esophagus, which carry the foods to the from the mouth to the stomach, or from the larynx and pharynx.
So there could be many reasons.
Yes, yes, yes.
For
even from air, or from air, or some problems around this cervical area. But most of neck pain during the main cause of the neck pain is the bad motions or bad habits, and it is present in long standing with leaning forward like that, or twisting position during writing, or sleeping on high pillows or low pillows, or something.
Yeah, I want to ask you
Sleeping
about
during sitting like that.
Yeah. I want to ask you about this, the pillows. Can you give us some guidelines on what kind of pillow? Is it soft? Is it firm? Talk about pillows.
Yes. Not actually. There is no a universal speak in this area. But the good pillow is the pillow who gives you a good sleep. So you can prefer a rigid one. I can prefer a soft one. But universally, the pillow must be the height of the pillow as the height of your shoulder.
Okay, so if I'm lying on the bed,
Not lying like that or like that.
I see. So if we're lying on our sides,
Yes.
right, the head should be not dipped down onto the mattress.
Yes.
It should be
aligned.
got it. Okay. Let's talk about some treatments that you offer for people who have, and I imagine it depends on the injury. Some people you see, they're in these car accidents, they're hit from behind, there's a sudden jerking. Can you talk about some of the treatments that you...
Yes. The best treatment of the spinal problems is the prevention. So we can prevent most of the problems. But if there's a problem happened and this pain, we can manage according to the cause. If there's mild injury or muscle spasm or something like that, this will be treated simply by some rest and neck collar and some drugs. But if there is a problem like fractures or strain or sprain, we may need to make X-ray and MRI and so on. Even surgery may be needed.
There was, in the United States, we just heard about a case where the police killed a young man. His cervical column was severed 80%. The victim was named Freddie Gray. It was widely covered internationally. the police actually broke his neck. And in the video that surfaced, maybe you've seen this, he was limp. He couldn't move, and the police actually had to drag him and carry him into the van. Do you think, what is your opinion, that he had already...
It is a very bad motion, very bad action, as we told from many minutes, some minutes. There is a protection of the spinal column or spinal cord. This spinal cord carry all nerve supply to both upper limb and lower limb. So if there is a fracture or cutting of this spinal cord in the cervical area, the patient will lose everything except breathing. He will lose motion in the hands, in the legs, even in bowel habits. He can't control urine or stool activity. So it's a very bad
the police, it got a lot of negative press on the force. They tried to say, the police tried in the van, and not because of them breaking his neck.
The spine is a very strong structure, very strong. We're facing every day many people walking and running and working, and many players jumping. There is no problem for the spine.
Right.
But the spine is injured from a vigorous injury, severe injury, major traumas, or falling down, car accident, like something like that. Or even in boxers, the cervical spine not injured, and but if the head is twisting actively, very strong, maybe broken, like hanging.
We hope, we're going to continue to monitor this case in Baltimore in the U.S. and hope that justice can be done, that these police officers can be held accountable for what they did to this young man. Doctor, we are at our break. We want to come back, and I want to ask you about a habit that we have of cracking our necks and our fingers. We'll have the doctor answer this question after a short break.
أفلا يتدبرون القرآن ولو كان من عند غير الله لوجدوا فيه اختلافا كثيرا.
We all know that a person's iman increases and decreases, and the best way to increase your iman is through the Quran.
To contemplate, to reflect, to ponder over the verses of the Quran.
أفلا يتدبرون القرآن ولو كان من عند غير الله لوجدوا فيه اختلافا كثيرا.
In this program, we will listen to the Quran first, and that should soften our hearts. And then once we get to know the meanings and contemplate over these meanings, then we can change by the will of Allah subhanahu wa ta'ala.
ولا يأتونك بمثل إلا جئناك بالحق وأحسن تفسيرا. ولا يأتونك بمثل إلا جئناك بالحق وأحسن تفسيرا.
Join us this Ramadan for Quran Circle.
Assalamu alaikum and welcome back to the program. We're joined by an expert in orthopedics. He's a professor of orthopedics at Al-Azhar University here in Cairo, Egypt. We're going to continue our discussion with Dr. Muhammad. Before the break, I promised the viewers that they would get an answer on whether or not it was harmful for us, this habit that we have of grabbing our fingers and cracking the bones in our fingers, and some people crack the necks. What is your comment about this?
Oh yes, it's a very good question, as this habit is done by most all people around the world. If some cracks like that, it's not a problem, but in cervical area we must care. In medicine is a big chapter in medicine called chiropractic.
Yes.
Chiropractic.
Yes.
The chiropractic is the motion of the spine,
Okay.
but this must be done by expert in chiropractic. The chiropractic depends on the motion of the spine by the expert to give or to relieve pain or relieve spasm, something like that. But this jerky movement,
Right.
rapid movement, may be harm the patient,
Okay.
may lead to some problems. And we facing some people make not expert people trying to do this for other people, and may lead to a big problem.
Yeah. Okay, so you've heard it, dear viewers, from Dr. Muhammad that the fingers may be not as harmful,
Yes.
but avoid all this neck stuff, cracking
Yes,
the
yes.
bones in the neck. All right, so we'll move down the spinal column to the back and talk about back pains and some of the common causes for back pain.
Yes. The back pain actually is in American Mayo clinics. They call 80% of people around the world 80%. It means 4 from 5
Yes.
expert 1 or more attacks of back pain during life. So it is a big problem.
Yeah.
And the second problem after cardiopulmonary diseases affecting the outcome of any patient around the world. So it is a big problem. And back pain, as it a so big problem, but it is an easy problem. Why? Because 90% of this back pain
Yes.
is a simple back pain. From sprain, from strain, from overactivity, and relieved even by without treatment.
Okay.
So it is a big problem, but easy problem. So if we facing what is the causes of back pain, we have to classify 2 big categories. Is it true back pain or false back pain?
Okay.
True back pain means back pain initiating from the lower back or the spine. The false back pain, which is back pain initiated away from the spine and referred to the spine.
Okay. So if I'm doing some work at the house, maybe shoveling some sand or something like that, and the next day I start to have pain in my lower back.
This is true back pain.
True back pain.
Yes.
Okay.
From overactivity or from muscle around the back. But I mean by false back pain, the pain initiated, example, in the urinary system, in the gastric system, in the bladder, in the gallbladder, in the pancreas, and referred to the back. And this is a big category. So affection, something in GIT, gastrointestinal tract,
I see.
like gastric ulcer or duodenal ulcer, maybe pain in the back. Gallbladder, maybe in the back. Pancreas, and the cancer head of pancreas is referred to the back.
So the back pain that we experience may not be related to the muscles or
Yes.
the bones. It could be a different system entirely.
Yes, yes, yes.
I've even heard, is it true that some heart conditions can cause back
Yes,
pain?
yes, like dissecting aortic aneurysm. It is a very dangerous one. Aortic aneurysm is a very dangerous and life-threatening problem. It may be manifested as a sharp back pain, sudden back pain.
Okay, so we have a picture here, an illustration of somebody experiencing back pain.
Back pain, yes.
Yeah.
This back pain from the lumbar area, which is a very common or commonest back pain, and this may be due to muscle strength, maybe due to overactivity, or maybe diseases in the spine itself, like disc prolapse, or infection or inflammation, or maybe more dangerous cases like malignancy or metastatic diseases.
Tamam. So if you have a more serious lower back condition, talk about some of the ways that you evaluate and investigate these conditions.
Yes, yes. When back pain is severe or not improved by medicine or by something like that, the patient start to visit a doctor, and the spine surgeon starting to analyze this pain. And if he facing some cases called red flags, or red flags,
Yes.
means dangerous signs.
Okay.
These red flags, the spine surgeon or the orthopedist started to manage this patient by taking good history, and start to make X-ray and other investigation like lab investigation, MRI, or something like that, to stand on the actual disease or actual problem to start a good treatment or a better health for this patient. So we have some, if we're facing some red flags like big in the pain in the lower limb associated with back pain, or weakness, or some like weight loss, chronicity, the patient cannot move, severe pain, associated problem in the body, we start to make an X-ray and some lab investigation, and we may find something like infection, something like disc prolapse, which is a common problem. And we're facing, and we treat the patient according to the cause.
You mentioned a virus that sometimes can cause these problems. In this case, how is the virus introduced into the body?
Yes. You mean infection?
Yes.
Infection mainly by bacteria, not a virus, but in this area is susceptible for spinal infection by two means, either from surgical interference during surgery, or from the body. The most or the more area which can give bacteria to the spine is the UTI infection. Urinary tract, the bladder, the urethra, especially in men via venous drainage, may be carried to the spine and gives infection or abscess formation.
So we're talking about a different system entirely. It can
Yes.
cross over from
Yes,
the
yes.
urinary system into the
spine, or from local area
Uh-huh.
around the spine, or something like chronic diseases like tuberculosis, TB,
Yes.
which is a common site is a spine,
Yes.
and leads to Pott's disease, which may end by paralysis if not treated.
Got it. All right. The prognosis for success after these treatments, what is the success rate like?
Yes, when we stand on the diseases and diagnose diseases well, we start treatment. Fortunately, these are treatment for most of spine diseases. Even surgery, we have some advanced surgery in the spine to correct these infections or tumors or something like that. Even with severe deformities, ankylosing spondylitis or scoliosis or some severe deformities may be corrected with in good manner, so the patient can regain his normal activity and normal work all over the time.
I want to ask you about something that I commonly hear, herniated discs.
Yes.
What is a herniated disc? How does it occur? And what's the treatment for it?
This is the disc actually is the structure between the two vertebrae. The disc is the structure between the two vertebrae.
Yes.
So it is a carry motion from each vertebra to adjacent one. So this is susceptible for an injury. If we carry heavy object
Yes.
or exposed to trauma, this disc may be prolapsed posteriorly and affecting the spinal cord. If this happened, this is affecting the motor nerve fiber or sensory nerve fiber, and leading to manifestation in the arm if the cervical disc happened, or if in the lumbar area, will affect the leg.
So it's caused by exertion.
Overactivity, yes.
Okay.
And then if we facing a case of prolapsed disc, we can manage either by physiotherapy or medical treatment or even surgery if needed. The surgery has a variety of surgery now, by a scope, by laser, by direct surgery for some cases.
And another term that we hear, a fused disc. Does that mean that one or more discs are joined together, or what is a fused disc?
Fused disc means the discs are released by bone tissue. Becomes a solid part between the vertebrae. So the motion segment will lose its activity. There is no motion between two vertebrae. Becomes one vertebra.
Is it painful, the fuse?
Sometimes painful. Some diseases like ankylosing spondylitis, it is an autoimmune disease occurring in men. The patient lost all disc, so they can't move his neck, lumbar spine, chest wall, and walking like a robot or like something like that.
So the appearance is very stiff.
Yes, stiff. And if he laying back, he can't touch the back. So it's difficult.
Yeah.
Sometimes walking like that.
Yeah, yeah. What causes a fuse?
This is autoimmune disease, not
Autoimmune.
autoimmune disease affecting the spine. So the spine becomes a strong one piece of bone.
Okay.
No motion.
Dr. Muhammad, we are down to our last minute. We want to try and touch on some things that are specific to the fasting month of Ramadan.
Yes.
In the little time that we do have. Certain activities that can aggravate if we have some problems. Just talk to us. Give us some advice about things that we should do or should not do during Ramadan.
Yes, yes. We advise all people to not stop the motion or movement, but a good movement or good motion. Good motion and good exercise will help us to make our spine healthy all over the time. Overwork or bad habits may lead to some problems. So we can avoid bad habits, long sitting, long standing, leaning forward, carrying heavy objects and something like that, and keep exercise all of the time, even after 80s and 90s of age. So if we stop motion or stop exercise, we stop the physiological activity of the spine, and this leads to diseases and something like that.
All right.
And the nutrition.
Nutrition. Yes, yes. Things that are rich in minerals.
Yes, yes, yes.
Okay.
But not over nutrition, so I become obese.
Okay. All right. Well, Dr. Muhammad Nigam, he is a professor at Al-Azhar University here in Cairo, Egypt, in spinal surgery and in orthopedics. We do appreciate him talking to us about our spinal systems and the spinal health. Thank you very much for joining us, Doctor. Yeah, and inshallah, we can have you back to join us. Thank you, dear viewers, for tuning in, and we do, again, wish you happy Ramadan and wish you success in your fasting. Assalamu alaikum wa rahmatullahi wa barakatuh.
Oh.